Yes,
I'm Dilini Sevanti
and you can start.
Rajakaruna. I'm Dilini Sevanti Rajakaruna, speech and language therapist, graduated from Faculty of Medicine, Ragarma, University of Kelaniya. My research was to study to determine factors considered by speech and language therapists in decision making for oral versus non-oral feeding in acute post-stroke patients. As you all know, dysphagia is a swallowing disorder which occur secondary to neurological lesions, and it can occur in four stages: preoral, oral, pharyngeal, and esophageal stages. Clinically, dysphagia decision making takes a significant role in oral versus non-oral feeding in acute post-stroke patients. So, my aim were to identify assessment methods and their findings and clinical challenges in clinical practice that are predominantly considered by speech and language therapists in deciding between oral and non-oral feeding for acute post-stroke patients. Uh, there have been no research studies regarding speech and language therapist common practices in decision making for oral versus non-oral feeding recommendations. So, to make similar decision for oral versus non-oral feeding, currently there have been no clinical guideline available in Sri Lanka. This is a term-based variation in clinical decision making. The uh, this is the and to determine oral versus non-oral feeding. That is the reason I did this research. Then under the methodology part, this was a mixed method study, and self-administered questionnaire was used to collect both quantitative and qualitative data. And there were 30 speech and language therapists participated for this, and data were analyzed by using quantitative part SPSS 22 version and qualitative part thematic analysis. Under the results section, uh, participant responses were thematically analyzed. So lack of caregiver supports, a lack of professional awareness, lack of instrumental resources identified as the challenges in clinical practices. Identification of assessment method used to prior to deciding the mood of nutritional intake. All the participants 30 indicated that conventional bedside assessment as a primary decision making procedure, and 21 participants opted for the simultaneous use of instrumental technique and bedside assessment. Assessment related factors that are considered when making oral versus non-oral decision. Participants were instructed to select 10 factors that are predominantly considered by oral versus non-oral feeding. So there were 46 factors. Among them, they had to select 10 factors according to the questionnaire. Then table 1 included frequency analysis of all the factors and ranked in order of their selection. Alertness was a factor that was ranked in highest, and other factors in an ascending order of rank in work of ability, history of pneumonia, ability to complete posture, automotor control, silent aspiration, frequency of aspiration, secretion management, awareness, and nutritional status. Conclusion: lack of the instrumental resources and lack of caregiver support, lack of professional awareness are the most prominent challenges faced by speech and language therapists. And bedside assessment is the most common assessment method, and most important 10 factors that are predominantly considered by speech and language therapists in this decision making for oral versus non-oral feeding in acute post-stroke patients. Thank you.